Okay, I want to talk about nipple shields because I think they're amazing, but sometimes I think they don't get used appropriately or they can be overused. So let me share some advice about them. I think nipple shields are amazing for certain people. They are life changing. However, before you just jump into using one, I would highly suggest you get seen and assessed by a lactation consultant. First, we want to make sure that it's appropriate to use one if there's other things that we can try before having to use one. Second, you want to be seen by a lactation consultant or somebody to make sure you're also getting the right size. Also, a lot of lactation consultants will tell you that if you are using a nipple shield, it is sometimes suggested to also pump after because sometimes that nipple shield, because it's a barrier between your baby's mouth and you, for some people, it can affect their supply. So sometimes they will suggest pumping afterwards. There also is some research out there, regardless of if you're using a nipple shield, pumping, but some hand expression prior to doing that can actually improve your milk supply. Lastly, your breasts do go through a lot of changes, especially just in those first few weeks, like as your milk comes in, if there is engorgement or not, if you had fluids or got very swollen, like in labor and stuff, that can actually make your nipples more flat. And actually, as time goes on and that kind of swelling goes down, then your nipple shape is more conducive to breastfeeding. So just keep in mind, like using a nipple shield, if you do use one, it's not necessarily forever. Some people don't use it for forever and ever and ever. Sometimes it just gets you through a few days, a few weeks. Some people use it longer term, but that's okay.